Physical examination. Health assessment is the collection of data about an individual's health. Physical examination is a head-to-toe review of each body system that offers objective information about the client and allows the healthcare provider to make clinical judgment. Purpose on health assessment: to make a clinical judgment or diagnosis about the individual's health state or condition, and to obtain baseline data about the client's functional abilities. Physical examination: for routine screening to determine the client's eligibility for health insurance, for acquiring a new job, and for client's admission to the hospital. Equipment: BP apparatus, thermometer, pen light, drape, screen, tongue depressor, nose spectrum, otoscope, stethoscope, percussion hammer, vaginal spectrum, gloves, and gowns. Procedure: assessment. Assess the client's physical and psychological aspect before and during the examination. For the rationale, the goal is to understand the patient and to determine the health status to provide the best care possible and help the individual obtain optimal health. Review the body areas to be examined. For the rationale, so that we are aware of a certain area of the body if it has bruises or wounds. For the planning, make a physical and environmental preparation before examination. For the rationale, during this preparation, nurses must be prepared and make sure the area where the physical examination will take place is clean, quiet, warm, and well lit. Determine and prepare materials, equipment needed. For the rationale, to conduct assessment easier and faster. Implementation: identify the client. For the rationale, to avoid mistakes and confusion. Explain the procedure to the client. For the rationale, so that the patient will be aware of how the assessment works. Properly position the client. For the rationale, to make the client comfortable. Take the health history of the client. For the rationale, the goal is to collect subjective information from the patient. Conduct physical examination using the 4 skills in physical assessment. For the rationale, using this technique will easily get the assessment done correctly. Make a physical, psychological, and environmental preparation before examination. For the rationale, client's comfort is vital so that it will lead to successful examination. A. Environmental preparation. Infection control. Hand washing is done before examination. Wear PPE as needed to reduce contact with microorganisms. Examination room. Client requires privacy. A well-equipped examination room is preferably and adequate lighting is needed. Equipment. Equipment should be clean and ready to use. B. Physical preparation involves ensuring the client is dressed and properly draped if examined is limited to a certain part of the body. It is unnecessary to undress the client completely. Positioning. Healthcare provider assumes proper positioning so that the body parts are accessible and client feels comfortable. Psychological preparation. Explaining the procedure to be done reduces anxiety. The healthcare provider should convey an open, receptive, and a professional approach. And gather and take the health history of the client. A. Personal history. B. Family history. C. History of present illness. And D. History of past illnesses. For the rationale, to serve as a purpose and easy track of health status. Conduct physical examination from head to toe. Cephalocaudal. Using the 4 skills in assessment. For the rationale, a head-to-toe assessment checklist. Purpose is to acquire insight into the patient's present health state, health requirements, and health outcome objectives. A. Inspection, the process of observation or the sense of sight. B. Palpation, assessed through the sense of touch, through the palpation, and the hands can make sensitive physical signs which includes roughness, texture, and mobility. Percussion involve tapping the body and the fingertips to evaluate the size, borders, and consistency of the body, and to discover body fluids and body cavities. For the rationale, determines if the underlying tissues are filled with air, fluid, or solid substance. And auscultation is listening to the sounds produced by the body with the aid of stethoscope. For the rationale, offers a rudimentary concept of what's going on within the client's body. Note the general appearance, level of consciousness, skin color, nutritional status, posture, mobility, facial expressions, speech, hearing, and personal hygiene. For the rationale, to determine if the client is normal and oriented, if it has any problems, we can easily determine and we can consult the physician. Good morning, ma'am. I am Arabella and I am your student nurse for today. May I know your name and age, ma'am?
Mostly Torres, 80 years old.
Okay. So after having or ensured that we have the correct patient in front of us, we can now proceed to explain what is the purpose of the assessment. So I'm here to perform a head-to-toe assessment or a complete physical examination, and we'll be starting this by obtaining your vital signs. We will be assessing your head, your neck, your facial features, hearts, lungs, abdomen, your lower and upper extremities, and also your neurological functionality. Is that okay to you, ma'am?
Okay.
So we do this in order to ensure that there are no signs of abnormalities and that everything is normal. And if there are any scientific abnormalities, you're going to be located back or loaded back in order to prevent further complications. Okay? Do you have any questions for me, ma'am, before we proceed?
No.
Okay. So before we begin, I would just like to ask you some questions. Do you have noticed any problems with your skin?
No.
Any problems with your facial features, like
No.
breathing,
No.
digestion,
No.
problems in locomotion and movement,
No.
personal hygiene,
No.
problems in emotional and mental safety?
No.
Have you been experiencing stress,
No.
anxiety?
No.
Okay, so do you feel anything now, ma'am?
No.
Okay, so now I will be going to assess your general status, and we'll be starting upgrading in your height and your weight, and afterwards I'm going to check your vital signs.
Okay.
So the first procedure is assessing the skin. So may I have your hand, ma'am? So the skin color is normal. Pwede na po kasi yun, ma'am. Okay. No signs of lesions. The skin moisture is normal. We're going to assess the nails. The color of the nails is normal. Mom is assessing the head, so first let me don my gloves. ma'am, the evenness of your hair is normal and the growth. So, and there's no infestation. Okay, so we're done. Okay, can you move your eyebrows for me, ma'am? Okay, thank you. Is assessing the eye structure and visual acuity. So, first let me inspect your eyebrows, ma'am. Okay. Can you blink for me, ma'am? Okay. Next is cornea. So, we're going to flashlight. Okay. Next is for the pupil color using peroxide. Okay. Next is the pupil reaction to light. So for this, we're going to turn off the lights. Okay, it's normal. Next is the reaction to accommodation. Tanong ka, huwag asa na ko without moving your head. Okay, napod tayo gitawag na 6 cardinal of days. So, ug asa na ko ilihok, dito ka magtanaw without moving yapon sa iyong head. Okay? So, okay, thank you, ma'am. Next is we're going to assess your ears, the auricles, the color symmetry, the auricles, elasticity, and areas of tenderness. So, may I touch your ear, ma'am? Okay, so far it's normal. And next is we're going to check your response to my normal voice. So, nakoy iingon, then imo ang sundugon. Okay, so paper,
Paper.
house,
House.
cat.
Cat.
Okay, next is my whispered voice. So, imo gyud mong sundugon o kung sa ko ingon. So,
Scissor. Light.
okay, thank you, ma'am. Next, ma'am, is we're going to assess your nose. So, we're going to check the external nose for any deviation in shape, size, or in color and flaring of discharge from the nears. External nose to determine any area of tenderness, masses, and displacement of bone and cartilage. Okay, ma'am, so let's see your nose. It's normal, there's no any discharge. May I touch your nose, ma'am? The nose is normal. Your mouth, nasal, oropharynx, the lips, the buccal mucosa, teeth and gums, tongue, and the tongue movement, and the oropharynx and tonsils. Okay, so can I say vertical? Can you move your tongue? Ano? Sulod na. Okay. Next is your teeth and gums. So far, ma'am, there is no discoloration. It's pinkish in color and no refraction of the tongue. So next, we're going to assess is your neck. So we're going to inspect your neck. So can I see your neck, ma'am? Okay. Next is palpate your thyroid glands. May I? Okay. Okay, thank you, ma'am. And next is the movement of your head. So can you see? Up, down. Okay, thank you, ma'am. So far, it's normal. So we're assessing your thorax and lungs. So can you please breathe for me, ma'am? Inhale, exhale. Inhale, exhale. So now is I'm going to inspect your thorax. So, pwede na po up mo shirt, ma'am. Okay. Inhale, exhale. Inhale, exhale. Inhale, inhale, exhale. So next is sa chest. Inhale, exhale. Inhale, exhale. So next is I'm going to feel your breathing. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay, ma'am. Okay, thank you, ma'am. Sit down. Okay. So far, there are no skin lesions. The thorax is normal, and the breathing also is normal. So next is we're going to assess your abdomen. We're going to inspect for skin integrity, the symmetry, and we're going to auscultate for vowel sounds and palpate your liver. Okay, now inspect your abdomen. Can I use? Okay. So far there is no skin lesions. And next is I'm going to auscultate for vowel sounds. Okay, ma'am, ang sunod is musculoskeletal. So, before that, may I know if napakagibati karon nga sakit?
Wala.
Or na may nakay past injury?
Wala.
Okay, ma'am, so pwede mo tindog. So, karon is sundugon na nimon sa akong baton. Demo. Sa likod. Balik ko down. Sa likod. Next is dalang kamot. Then, so, pwede i-down sa isa. Then, kung hawiran, then, mangusog Okay, ma'am, atong next is neurological. So, pwede maliwaingon sa ako imong name, ma'am.
Roslyn Torres.
Okay, kabalo ba ka unsay date karon, month ug year?
May 24, 2022.
Kabalo ba ka asa ta karon, ma'am?
Sa Balay.
Then kabalo ba ka og kinsa atong current na president karon?
President Rodrigo Duterte.
Okay, ma'am. So, ang next is ako kang pangkanon kani mo ning sharp kani dal.
Sharp. Dal. Sharp. Dal. Sharp. Dal. Dal. Sharp.
Thank you. Next, ma'am, is we were going to check your reflexes. Evaluation. Evaluate findings of health assessment and physical examination done on the patient for the rationale so that we can easily get the accurate result. Documentation. Record or document and report any pertinent findings found during assessment to appropriate personnel. For the rationale, to assess patient if it is something wrong with the part of his or her body and report to the physician to seek help.